Social care recruitment and retention is getting hard. It's certainly getting harder. I've never known it as hard as this, and I think we're facing more pressures in the future than we even have now. So there are some factors, the headwinds, if you like, that are beyond the control of individual providers, and these are things like the demand, of course, for social care, particularly driven by the ageing population. There's many more people needing care and support, and will be in the future, and that means new entrants coming into the market, organisations trying to support those people, means they want the same, really trying to pull from the same workforce. We're also seeing the classic care worker demographic of the sort of female 30s to 40s. That's tailing off while the growth of older people is getting more and more, and so there's a bigger demand and less opportunity from the sort of typical care worker cohort to fulfill it. But there's much more going on than that. I mean, there's obviously negative media pressure. The social care sector doesn't have that brand halo that the NHS has, and that's always going to be a problem, and there may be something we can do about it, but difficult at the moment. It can take time and money and a lot of a sort of attitudinal shift to do it. The media, of course, also like a negative story. That's a bit of a pain, can put people off. And once you become a care worker, then there's a lot more responsibility in the job now. So in the UK, or certainly in England, then Care Quality Commission expectations quite rightly are high. We're seeing more complexity in the types of cases and the conditions, the illnesses and the frailties of the people that need looking after. And that puts more pressure on the individual care worker. Also, the care worker population is ageing, and part of the reason for that is it's hard to get the under 25s to come into social care. They seem more resistant to joining the workforce than they were in the past, and there are many reasons why. I think there's societal change. For example, smartphones are having an impact. I think, the ability for people to communicate without having a face-to-face contact with another human is not helping us. So I think Snapchat is those sorts of technologies make it much more or less likely for the younger people to be in contact with someone in their community, to become sort of more isolated and more reliant on technology. And that isn't really a good grounding for social care. So I think with things we can do about it, certainly I'd like to bring back a sort of national civilian service, for example, to get younger people to get an exposure to it. But these things are not within the gift of a particular care provider. I think you also when you look at more what care providers can do themselves, then we're seeing there's a lot of inefficiency in the recruitment process, and I think this is a big opportunity which care providers perhaps have sat back and carried on recruiting the way they always used to do, and in fact they can do a lot more now, and it's very difficult. It's a very fragmented sector. There isn't Skills for Care do a great job telling more people about what they can do, but people are very recruiters are very busy. They can be quite insular, just doing the same sorts of things and using the same procedures, and often the recruitment process is going out of kilter with what consumers, effectively candidates, are expecting now. Their expectations are much higher. They want a quick turnaround, they want instant response, that kind of thing. So there are a myriad of issues, some of which, though, I think there is optimism that we can do something about in the sector ourselves.